Good morning, dear students. Let's start our pathology lecture. Topic today: bacterial airborne infections. Let's talk about this disease: scarlet fever, diphtheria, and meningococcal infection. Scarlet fever. Scarlet fever is an acute infection disease characterized by symptoms of intoxication, sore throat, and skin rash. Infection disease. Acute infection disease characterized by symptoms of intoxication, sore throat, and skin rash. Etiopathogenesis. Causative agents of scarlet fever is hemolytic streptococcus group A. Hemolytic streptococcus group A. Etiology. The source of infection is patient with any form of streptococcal infection. Any form. The main route of transmission is airborne. Atrium is mucous membranes over tonsils and pharynx. Atrium, mucous membrane of the tonsils and pharynx. And sometimes superficial bones and bones. In the microorganism, streptococcus spreads by lymphogens and hematogens pathways. Streptococcus spreads by lymphogens and hematogens pathways. Causative agent streptococcus multiplies and produces endotoxin. Multiplies and produces endotoxin. And manifestations of the disease are caused by the septic, toxic, and allergic effect of a pathogen. Pathogen have a septic, toxic, and allergic effects on the body. About classification. Scarlet fever divide according to the type. Typical form and atypical form. In this disease, present typical form include primary effect and rash on the skin, and atypical forms. Atypical forms include subclinical form, this is scarlet fever without rash, aggravated form, and extrabuccal form. Next, classification according to the severity of this disease. According to the severity. Present mild, moderate form, and severe form. Mild, moderate, and severe form. Severe form include toxic, septic, and toxic septic form. Toxic, septic, and toxic septic form. This is severe form. Classification according to the course. Scarlet fever without allergic waves, with allergic waves, and abortive form. Without allergic waves, with allergic waves, and abortive form. And the classification according to complications. maybe allergic complications. Allergic complications, for example, nephritis, arthritis, synovitis, and reactive lymphadenitis. And purulent complications have a local character or maybe septicopemia. Period of the disease. We have two periods in this disease: toxic periods and allergic period. Toxic, the first period, toxic formation due to actions of the streptococcus toxins include morphological manifestations include local change and general manifestations. Local change present primary scarlet complex. Primary scarlet complex include catarrhal inflammations of the throat and tonsils. Catarrhal inflammations of the throat and tonsils. Necrotic angina and lymphadenitis of the cervical lymph nodes. Primary scarlet complex, catarrhal inflammations of the throat and tonsils, necrotic angina, and lymphadenitis of the cervical lymph nodes. In this slide you can see primary scarlet fever, inflammatory change in the place on the primary fixations of pathogens in the tonsils. Formation purulent necrotic inflammation. Here zone edema and hyperemia, and here zone purulent exudate on the tonsils. And inflammations in regional lymph nodes, regional lymphadenitis, increase lymph nodes. You can see here and here, increase lymph nodes. Manifestations with process edema, necrosis, infiltration by inflammatory cells, and hyperplasia of lymphoid tissue and enlarged lymph nodes. Primary scarlet effect. And about general change in this period. General change include intoxication, fever, next exanthema, this is a rash on the skin, exanthema, and lamellar exfoliations of the skin, lamellar exfoliations of the skin. In this slide you can see local change in the form necrotic angina or flaming throat, necrotic angina. The mucous membranes of the pharynx is hyperemic, with covered with mucous exudate, tonsils slightly enlarged, tonsils, and present numerous focus of grayish necrosis and ulceration. Grayish necrosis focus, ulceration, and small hemorrhage. And crimson tongue with scarlet fever, strawberry tongue. Clinical signs. And general manifestations: rash on the skin. The rash appearance from the second day of illness has a point-like character, bright red color, and covers the entire surface of the body. With the exceptions of nasolabial triangle. You can see pale nasolabial triangle pale zone, present skin, rash on the skin, and pale zone here. In the skin, marked platera, in focus of rash, platera, edema, perivascular lymphohistiocytic infiltration, in the surface layers of epidermis where vacuolizations of cells, parakeratosis, and necrosis. In future, areas of necrosis are reject, and characteristics: lamellar peeling over skin after rash. Formation lamellar peeling over skin occurs on the secondary third week of the disease. Desquamation on the skin after rash. Desquamations. Next, secondary period of the disease, allergic period. This is 2-3 weeks of illness associated with the penetrations of a pathogen in the blood, penetrations of a pathogen into the blood, destructions of microbial particles, and allergizations of a body, by streptococcus antigens. Manifestations of these periods: acute or chronic glomerulonephritis, serous arthritis, watery endocarditis, vasculitis. Next, manifestations in parenchymal organs, in the liver, in the kidneys, in myocardium, formation dystrophy protein and fatty dystrophy of parenchymal cells, and interstitial inflammation, fatty and protein dystrophy, and interstitial inflammation in these organs. Next, manifestations and in lymph nodes, spleen and lymphoid apparatus, lymphoid tissue hyperplasia, and myeloid metaplasia. And finally, formation circulatory disorders, and degenerative change of nerve cells. About complications. Complications formation in severe toxic form and severe septic form include severe general intoxication, severe hyperemia, affecting even the esophagus, hyperplasia of lymphoid tissue, and severe circulatory disorders, and dystrophic change in the organs, severe circulatory disorders, dystrophic change in the organs. In severe septic form complications, purulent necrotic change in the throat area, with the development of a pharyngeal abscess, and purulent otitis, purulent osteomyelitis, of a temporal bone, purulent ethmoiditis, purulent necrotic lymphadenitis, and phlegmon of the neck, And next complications, septic pyemia, and infectious toxic shock. Next disease, diphtheria. This is acute infection disease, accompanied by fibrinous inflammation in the place of fixations of a pathogen, in the place of fixations of the pathogen, and general intoxication. Etiological factors for diphtheria. This is Carinobacterium diphtheria. Carinobacterium diphtheria produce exotoxin with necrotic effect on the tissue. Exotoxin of Carinobacterium diphtheria affect necrotic, vasoprolytic action, and neurotropic action. Necrotic action, vasoprolytic, and neurotropic action. In pathogenesis, the entrance gate of a bacteria are mucous membranes of the upper respiratory tract. And sometimes damage skin. The entrance gate, necrosis of the epithelium and tissue. At the entrance gate, formation necrosis of the epithelium and tissue. With formations fibrinous film. First formation necrosis, and after necrosis formation fibrinous film. Fibrinous film contain a large number of bacteria. The general effect of exotoxin is manifested by damage to the cardiovascular, nervous systems, and adrenal glands. General effect due to action of exotoxin in cardiovascular, nervous, and adrenal glands. Local change include diphtheric inflammation of the mucous membranes of the pharynx, larynx, trachea, and bronchi. And very rarely diphtheria localizations over nose, eyes, skin, and genitals. Other localizations. On the necrotic mucous membranes over tonsils, formation dense yellowish white films about 1 millimeter thick. Dense yellow white films. In the adjacent areas of the mucous membranes, full-blooded with small hemorrhage. The soft tissue of the neck are swollen. Sometimes swelling extends to the front wall of the chest. Soft tissue of the neck are swollen, and sometimes swelling extends to the front or anterior wall of the chest. Fibrinous films doesn't reject for a long time. Fibrinous film doesn't reject for a long time, which creates conditions for the absorption of exotoxin, and cause severe general intoxication. Absorptions of exotoxin and severe general intoxication. Local change in diphtheria, diphtheric or fibrinous films. You can see and appear focus of hyperemia and edema over mucous membranes and edema over neck. Spread edema over skin, over neck, over soft tissue. And microscopically, inflammations in diphtheria has a diphtheric character due to the deep tissue necrosis over tonsils, and presence of a squamous epithelium lining the mucosa. The mucous membranes of the throat is necrotized. Mucous membranes necrotized, soaked with fibrin exudate on the surface, forming a thick film tightly welded to the underlying tissue. Thick film tightly welded to the underlying tissue, and the submucous membrane is full of blood, swollen, and inflammatory process infiltration by leukocyte. General manifestations, general change in diphtheria include toxic myocarditis, this is fatty dystrophy and myelinosis of cardiomyocytes. Fatty dystrophy, myelitis of cardiomyocytes. Outcome: diffuse cardiosclerosis and heart failure. Diffuse cardiosclerosis and heart failure. Next, change small vessels contain fibrin clots due to coagulopathic effects of exotoxin. Formation fibrinous clots in small vessels. Next, change in nervous system. Diphtheric polyneuropathy, neuritis, and degenerative change in ganglia and necrosis, and due to this process, formation paralysis. Next, change in adrenal glands. dystrophy and degeneration, necrosis of the cells, and small hemorrhage in the stroma. Small hemorrhage. In kidneys, formation necrotizing nephrosis, or acute renal failure complications. Acute renal failure. Change in lymph nodes, spleen, and bone marrow. In lymph nodes, spleen, and bone marrow, formation hyperplasia of lymphoid tissue. Hyperplasia of the lymphoid tissue. Let's talk about outcomes and complications in diphtheria. Outcomes in early periods, early death. This is first 2 days of illness due to heart failure, acute heart failure. In later, for example, 3 months, outcome varus necrosis and myocardiosclerosis. Complications. True group. The main complications in diphtheria, true group. True group, this is asphyxia due to obstructions of the airways, due to the accumulations of fibrin, mucus, and spasm of the smooth muscles. Asphyxia due to obstructions of airways due to accumulations of fibrin, mucus, and spasm of the smooth muscles. You can see in this slide. True and false group. In diphtheria, true groups formations. Edema and spasm. And obturation due to formations of diphtheric films. Water zone, diphtheric films. Next complications, aspiration pneumonia, parenchymal myocarditis, polyneuritis, adrenal necrosis. Next complications, adrenal necrosis and acute adrenal insufficiency, necrotic nephrosis, and acute renal failure. Necrotic nephrosis and acute renal failure. Next complication, cerebral edema, and toxic shock. False group. And next disease. Let's talk about meningococcal infection. Meningococcal infection, acute infection disease, with a variety of clinical manifestations, from nasopharyngitis, and asymptomatic carriage, to generalized forms. We have 3 main forms in this disease. Meningococcal nasopharyngitis. Next, purulent meningitis, and meningococcemia, or septic generalized form, meningococcemia. Etiology, Neisseria meningitis or meningococcus. Neisseria meningitis, meningococcus. A source of infection, patient and carrier of bacteria, patient and carrier of bacteria. The main route of infection, airborne. The main route, airborne. Pathogenesis, pathogenesis. Invasion of a nasopharyngeal mucosa. Pathogen invasions of a nasopharyngeal mucosa with formation meningococcal nasopharyngitis. When hematogens spread, formation hematogens spread, fixation in the pia mater, fixation in the pia mater, and formation purulent meningitis. Purulent meningitis. Next, generalization of infection. Generalization of infection. Intensive phagocytosis. Release of a large amount of endotoxin into the blood. Release of large amount of endotoxin into the blood. And effect, paresis of small vessels, paresis of small vessels, stasis, thrombosis, hemorrhage, necrosis in organs due to general effect of endotoxin, and bacterial shock. Bacterial shock. Let's discuss pathomorphological change in different form of meningococcal infection. At first, acute nasopharyngitis. Signs for acute nasopharyngitis are catarrhal inflammations of the pharynx and nasal mucosa. Catarrhal inflammations of the pharynx and nasal mucosa. Edema and hyperemia. Edema and hyperemia. Serous or mucous exudate. Maybe corpus formation. Serous mucous exudate. And lymphoid hyperplasia posterior pharyngeal follicles. Lymphoid hyperplasia posterior pharyngeal follicles. Next form, meningococcal meningitis. Meningococcal meningitis develops when meningococcus enters or spreads to the bloodstream, breaking the hemato-encephalic barrier. Morphological manifestations in the brain membranes. Formation cycological disorders and formation serous exudate. Serous exudate on the 1-2 days of illness. First, secondary days of illness. Formation serous exudate, and when on the third day, formation purulent exudate. Purulent exudate. Vessels. Blood vessels are sharply foul blood. Subarachnoid space is extended, and microscopically large number of neutrophils in purulent exudate. Large number of neutrophils. After purulent exudate formation, fibrinous exudate during fibrinous exudate, secondary week of illness. Purulent exudate contained a large amount of fibrin. And on the third week of illness, formation outcome, this is a resorption and organization of exudate. Resorption and organization of exudate can lead to obliterations obliteration for ventricle, and development of internal hydrocephalus with increasing atrophy of the brain substance. In the slide you can see macro and microscopical change in pia mater. In purulent meningitis, the pia mater is thickened, dull-looking, diffusely covered by thick mass of greenish yellow color. Purulent exudate in the form of thick mass of greenish yellow color on the surface of the pia mater. And microscopically, pia mater is thickened and diffusely infiltrated by neutrophil leukocytes. Neutrophil infiltration, diffuse, blood vessels enlarged and full-blooded, and perivascular and pericellular edema. You can see perivascular and pericellular edema, focus of edema, dystrophic change of the nerves, in brain substance. And next form, meningococcal sepsis or meningococcemia. Meningococcal sepsis or meningococcemia, characterized by generalization process into the vessels, change in the joints, parenchymal organs, adrenal glands, and kidneys. Signs include hemorrhagic rash, multiply hemorrhage on the mucous membranes and serous membranes, hemorrhagic rash on the skin, and multiply hemorrhage on the mucous membranes and serous membranes. In the joints, formation serous arthritis. In the adrenal glands, develop massive hemorrhage and focus of necrosis. With Waterhouse-Friderichsen syndrome, acute adrenal insufficiency due to massive hemorrhage and necrosis in adrenal glands, formation complications, acute adrenal insufficiency, Waterhouse-Friderichsen syndrome. Waterhouse-Friderichsen syndrome. And next manifestations, necrotic nephrosis. Possible. Possible fulminant form of acute meningococcal sepsis. Manifestations: infection, toxic shock, develops within a few hours. Hemorrhagic syndromes, you can see rash on the body, and small hemorrhage under the endocardium. Focus of hemorrhage under the endocardium, hemorrhagic syndrome. And massive hemorrhage in the adrenal cortex, massive hemorrhage and necrosis in the adrenal cortex. And purulent meningitis. Causes of death. Bacterial shock, acute adrenal failure, acute renal failure, swelling of the brain, hydrocephalus, and later complications and causes of death, cerebral cachexia in the late period, cerebral cachexia. That's all today, dear students. Thank you for your presence, thank you for your attention, and see you later. Goodbye and good luck.